Fox 6.
Nurses, healthcare workers, and hospital staff across the state celebrating new legislation to prevent violence in the healthcare industry. Welcome everyone to Western Mass News on this Wednesday night. I'm Amanda Martin Ryan. Our reporter Addie Patterson joins us now in studio with more on this new legislation and the push for it to pass. Addie.
That's right, Amanda. A new bill to protect healthcare workers from violence passed in the State House earlier today with substantial support from lawmakers. It's now moving to the Senate for approval. The legislation comes from an unprecedented partnership between hospitals, nurses, and healthcare worker unions, all saying that violence against healthcare workers is a growing crisis. Healthcare employees experience violence far more often than any other workers, and according to the Massachusetts Nurses Association, here in our state, someone in a hospital is assaulted or threatened every 36 minutes. Massachusetts nurses and healthcare workers report high rates of being punched, kicked, bitten, and subject to verbal and physical threats on the job. Data from the Nurses Association shows thousands of injuries happen each year in the industry, with many accidents going unreported. If this bill is approved by the Senate, the legislation would require every hospital to assess safety risks and create a violence prevention plan involving frontline workers directly in designing those protocols and trainings.
The dedicated men and women who deliver health care in the Commonwealth oftentimes do so under difficult and high-stress conditions. They care for us, our loved ones, and our most vulnerable. And yet, far too frequently, they face violence in the very place they go to heal others. This bill acknowledges that it's unacceptable for those entrusted with caring for our community to do so in unsafe workplaces.
Healthcare leaders praising the bill's approval earlier today, calling it a major step forward, making hospitals safer for their staff and their patients. The bill would also provide stronger protections for healthcare workers and extra paid leave for workers who are assaulted. Reporting in studio, Addie Patterson, Western Mass.